Good morning, everyone. It is the May 8th on Friday media briefing by Bryan Health. I'm Bob Ravenscroft, the Vice President for Advancement. I think most of you know that by now. With me today is John and then Alexa Lewis, the Director of All Things Kids and Babies here at Bryan. So first of all, I want to thank members of the media that shared the mask graphic that Dr. Johnson presented last night. We've seen it. And then interesting, it was really telling us how people really want some nice, simple, clean instruction. It reached over 54,000, almost 55,000 people on our social channels as of this morning. I'd like to add that for any small, mid-sized, or actually large area businesses, as you prepare to open safely, and if you have a desire to keep your employees and your customers safe, we're making this available to anyone. So if you would like a poster, flyer, or whatever other collateral that we are planning to produce or might produce with the mask graphic, please contact the Bryan Advancement Office at 402-481-8674, and we'll be happy to accommodate you there. So John will share a little bit about the in-house activities, and then with Alexis, we have a short story to share with you, and it's really a story for all of us. We all have moms and grandmas and so forth, but perhaps even some of us are fortunate enough to have great grandmas to celebrate on Sunday. During this pandemic, there have still been births taking place at Bryan at its usual clip. Just as a point of reference, we deliver between 3,300 and 3,600 babies each year. This is the third most of any hospital in the state of Nebraska, right on the heels of Nebraska Methodist and the CHI hospitals in Omaha. Bryan, along with those two, account for 55% of all births in Nebraska. If you add in Nebraska Medical Center, that accounts for 65%, and the other 60 hospitals or so account for the remaining 35%. So that's a lot of babies. So how we'll do this today, because of the short video and Alexis's presentation, after John will play the short video, which will be part of the B-roll package that is sent to the media. After the video, Alexa will come up, and then we'll follow the normal routine and respond to any questions you might have. A little bit about Alexa. Her responsibilities are for the mother-baby unit, the neonatal intensive care unit, pediatrics, and she'll tell a little bit about what it's like to help people deliver and bring new people into the world during the pandemic, different things and processes that are taking place for both the babies and the parents. So with that, let's get right to the stats. Our midnight census was 401. Usually Bryan's in the high 4s to 530-ish on a kind of an average basis. So things, as you've been following this, are ticking up a little bit. And then for our stats, related to COVID-19, they're not really going in the direction any of us would like. With Mother's Day coming up, we know that conventional wisdom tells us there's going to be some gatherings. Please don't be bashful about sharing the kind of masking procedures we shared yesterday to keep your family and so forth healthy, and don't, just adhere to what will keep your family safe. Total tests administered by Bryan Health entities now are at 5,058. Our positives, as of this morning, have climbed to 637. Negatives, 3,992, and there are a significant number pending at 424. So, yeah, you guys have been tracking this. That's definitely on the upward slope right now. So, with that, I'll give you John.
Thanks, Bob. As Bob talked about our pending number of 424, just realized that we performed almost 300 tests just yesterday alone. We have 20 positive COVID patients in-house, same as we did the day before. We have 2 pending patients. We have 7 that are in our intensive care unit and 5 in our progressive care unit and 8 in our general care. Our mobile unit, it looks like we'll probably make another trip to the Crete location next week. More of a community-wide type testing to be done there. We are working at doing one in Lincoln. It looks like we'll probably be targeting next Friday or Saturday, and that is really for our cultural centers that we'll be focused on. I did want to comment, this is the time of the year we typically have our graduation for Bryan College of Health Sciences. And we're going to do that tonight virtually at 5:30. So you can go ahead and see that on Facebook. We have our graduates have sent in their pictures, so we'll be able to show their pictures and have a virtual ceremony. And then on Saturday, there's actually going to be a drive-through where they can come and get their diplomas as well. So we're still trying to honor those traditions that you typically see at this time of the year, and we look forward to celebrating that with our graduates. With that, I'm going to turn it over to the video next.
My water broke on Easter. I was informed that I did rupture and was told to come straight to Bryan. Then I was admitted and stayed around three weeks until May 2nd, when Madden was born around 10:40 in the morning. When I was in the hospital, I was very worried, of course, about, my husband was taking care of my other kiddos, and he was doing a great job. But what if something would happen, so there's fear, there's anxiety. I do feel it's important to stay positive, and I think that worked out for the best. He's wonderful. He was born, he weighed 5 pounds, 2 ounces, 17 inches long, so he's a big boy, but he's doing so great every day. The doctor tells me he's a good patient, and he's continuing to meet those milestones as he needs to. He's a perfect little boy. I can't tell you how much that floor and the staff of the NICU mean to us. They have been so great and so supportive. There's no words. They're just wonderful, wonderful people. I'm just so blessed to have 3 beautiful, healthy children, and they make me so happy. It's all I've ever wanted, was to be a mom, so I'm just very thankful.
Good morning. As Bob said, my name is Alexa Lewis. I'm the nursing director here at Bryan Medical Center for our Women's and Children's Services. I was so grateful that Erin and her family could share Madden's story here at Bryan. So Erin and Stuart are from here in Lincoln, and they have 2 other children. Sheffield is their son, and Joey is their girl. And they have been trying to adapt to life in this COVID world, as we all have been. But our staff has really helped them overcome the stress of not only a preterm delivery and a long hospitalization for pregnancy complications, but how to keep their kids involved too. Yesterday when we were shooting that video, one of the NICU nurses brought a card by that she made for the big brother that said, "I don't need a superhero, I have a little brother named whatever." And it was just so sweet and such a great way to celebrate our families, as we do every day. Our world has definitely been impacted by the COVID pandemic. Like everywhere else in the health system, we've had visitor restrictions, which means in our pediatric unit, only 1 parent can visit, which is challenging, especially if it's a young child. So supporting our families through that. For the birth experience, again, we only limit it to 1 visitor. We want it to be that emotional support person, so mom can have that family-centered birth experience that she was hoping for, with the partner of her choice, to have that once-in-a-lifetime experience. So we are adapting to that. One of the things that I found really fun with our staff when we went to the universal masking and our staff had to cover up their face was a fun idea that they had, that they would show a picture of themselves to their patient on their phone, although it wasn't their picture. They picked their celebrity they wanted to be. So like somebody was Marilyn Monroe and someone else was Scarlett Johansson. So just finding some fun in a very stressful environment is one way that our staff is coping with it. Our volumes definitely haven't slowed down over this time. In March, we had 313 babies delivered here at Bryan. And in April, we had 292, and we're on track to have a similar month here in May with 67 born already this month. Our staff continues to adapt to support our families where they're at. Every day brings new challenges. One of the things that the NICU staff shared with me was one of our moms who's been here for about 10 weeks with her premature baby had a birthday this past weekend. And so the staff tried to celebrate mom by having a birthday party for her. They made her cards, they brought her gifts, they made her baked goods, and really just celebrated her, because it's not been about her. She's really been trying to balance her children back at home. She lives an hour away from the hospital. And how does she spend her time between her other children and her sick baby in the NICU? So that day was all about her. And that's what this weekend we hope to be about, is about moms as well. One other story I wanted to share with you is we had a patient that was readmitted shortly after her delivery, and she was on our pediatric or women's health floor, and that she was pumping while she was recovering from her illness, and her sister was coming to get her breast milk, and the nurse had the great idea of having the sister or the aunt bring the baby to the window so that mom could see her newborn, even though she was sick and needed to be isolated away from her baby, and helped really lift her spirits and just helped in her recovery. So those things are everyday things that our nurses always do, but are just so much more important now in this time of social isolation and our visitor restrictions. So thank you for letting me share our stories and your continued support for the community and all of our healthcare professionals at this time. Have a great Mother's Day.
I don't know the socioeconomic or the ethnicity breakdown specifically at Bryan, but yes, we in general know that it is impacting certain communities harder. So that is exactly why John's working with the health department to find those areas where language barriers might be an issue, where other barriers to access might be an issue, and we need to know where this is in the community. So they're working closely on identifying those. I would say we're going to try to stay consistent here. We completely understand everybody's urging to get back out there. Obviously, there's some concern. You heard it in Dr. Johnson's voice yesterday. That's why we're going to have an all-out effort on mask awareness from the medical community in the state and from Bryan, because that's going to be one of the last lines of defense as we open up. It's going to be the personal responsibility everyone takes. So yes, there is some concern, but we also understand it, and we're going to do all we can to help.
We're working with our officials and just looking at the potential of what could occur. And I think all we can do is continue to educate people. And if they follow the guidelines, we think the risk of opening up diminishes. But if people just feel that everything's okay and we can go back to normal, then we're going to have an issue on our hands. I think if you guys are following Douglas County at all, so they lifted some of those restrictions last week, and we're starting to see their numbers climb again. And at least from what I have read and seen, it looks like South Omaha is starting to become kind of a little bit of a hot spot. So it just goes back to people following the guidelines. And you do have to open up at some time, and to what level you do, everybody has a different opinion of that. But I think all we could do is work with our officials. If we start to see it getting out of control, we're going to have to pull back again in relationship to it. But I tell you, they're not doing this in isolation. I know when they talked about opening up salons or restaurants and that, they're talking to those groups of people that own those. And they're having some very good dialogue about what we should be doing and what we could be doing. So that's not being done in isolation. They are really bringing all the stakeholders to the table and having some good dialogue about how far we should go with restrictions.